So now I've done my prep and done my assessment. Some other things I need to do is to grab 2 pieces of tape. I have one here, and then one of my pieces of tape, I want to make tape pants. So with that, you'll take a piece of tape and you're going to split it down the middle, leave part of it halfway available, and then take one of the pants legs and just flip it over, okay? That'll keep from the 2 legs from sticking together when you're ready to tape it, all right? So Mrs. Dan, I'm all ready to insert your NG tube. I'm gonna hand you a cup of water so that once I get the tube in, I'm gonna ask you to take sips of water to help facilitate the tube so that it goes in your esophagus and not through your airway and travel to your stomach. Does that sound okay? You understand? Okay, all right. So, grab my tube. I've already measured, okay. All right, so I've decided to use the patient's left nair, all right. So you're gonna feel a little discomfort, okay? All right, I'll tell you when to take the glass of water and start swallowing. All right, here we go. Okay, once I get it towards the nasal pharynx, or you will feel a resistance, I'm gonna have the patient flex their neck. All right, Mrs. Dan, I need you to take some drinks of water, okay, and I'm gonna go ahead and push this in. I'm checking to make sure the tube is not coming out of her mouth. I'm also checking for chest rise and fall, make sure she's breathing okay, she's not getting anxious, not getting cyanotic. And if you have a little difficulty, you can twist it. Okay, and I'm at my measurement mark. All right, we're all done. You did good. Okay, so I'm gonna just hold that there, and I'm gonna go ahead and secure my tube with my tape pants. And so what you'll do is lay the tape on the bridge of the patient's nose. And then wrap your legs around your tubing. Your tape around your tubing, sorry. Doing okay? All right, she's breathing okay, the tube's in. All right, so I need to assess that this is in the right place. And there's a few ways I can do that. One way is by x-ray. Another way is we're going to auscultate to make sure that we have it in the right place. So I'm gonna grab my stethoscope and take my irrigation tray and pull back, use my syringe and pull back no more than 10 mLs of air, okay? You want to hook your syringe in the clear part of your tube, okay? This blue part is an air vent. It's not for auscultation of checking for placement, okay? And then I'm going to put my stethoscope over the abdominal region, and I'm going to push the air inside this tube, and once I do that, I should hear through my stethoscope a swishing noise. Okay, so I'm going to do that. Alright, and I was able to auscultate and hear the appropriate noise. Okay, while that tube is still attached, I'm going to aspirate, and I'm looking for GI contents. Okay, and I'm going to aspirate enough so that I can check the pH of the contents to determine if I am in the stomach. Okay, and what you can do is just clamp that off so that it doesn't spill out. And I'll take my little strip, put my GI contents on my strip. According to my protocol, I'll follow my protocol to determine if that's the correct pH for the patient. Okay? All right. So what I have left, I'm going to give that back. And then we'll flush it all the way through. And you just need no more than 20-30 mLs of saline. Okay, so I'm gonna flush. So my doctor's order is to do this to low wall suction. So I have my suction. I'm going to turn my canister on and turn it to low wall, 80 to 100. About the yellow is where you want your gauge to be. Okay. So I got that ready to go. I'm going to check for my pressure. Okay. And then I will connect an adapter to my suction so that I can attach it to my NG tube. Okay. That goes in the NG tube. Okay. And you should start seeing GI contents coming out. Alright. And then last but not least, I'm going to secure my NG tube to make sure that the tube doesn't accidentally pull out. And the way you can do that is take a piece of tape. Wrap it around the tube, and then you will have a safety pin. Poke through the tape and then attach it onto your patient's gown. And that way, if the tube has any pulling, it's going to pull on the gown versus pulling up here. Okay? You doing okay, Miss Dan? Alright. So, I'm going to get you back settled. Also, I'm going to note how much output my patient has and document it. Color, odor, consistency, and amount. Also, since she has an NG tube, I don't want my patient's head of the bed any lower than 30 degrees. So I'm going to lay it back just a little bit and make sure that she's at least at 30. Let's just keep you in there. That's about 50. Okay? Alright. Clean up my mess. Let's give you your call light. I'm sorry, I had to reach over you. Alright, call lights in reach. My bed rails are up.